Bonjour tout le monde. Hello, everyone. Welcome to today's online event featuring very great speakers who will be discussing promoting new ACB immigrant integration in Canada, CADHO's strategic role. And before we begin today's event, we'd like to begin with an acknowledgement that N4 is hosted at CHEO, which is located in Ottawa, Ontario. Ottawa is built on unceded Algonquin and Anishinaabe territory. The peoples of the Algonquin and Anishinaabe Nation have lived on this territory for millennia, and we honor them in this land. Their culture and presence have nurtured and continue to nurture this land. We also honor all First Nations, Inuit, and Métis peoples, and their valuable past and present contributions to this land as well. My name is Andrew Tomeyer. I go by the pronouns he, him, and I'm the education coordinator with N4. I will be hosting and moderating today's presentation. My co-host is today Colleen Drake, who will be monitoring the Q&A today. Now I would like to introduce today's presenters. We originally had the president of CADHO, Dr. Benini Cahoon, to present, but due to an unexpected emergency, he will not be present today. We do have Dr. Ruby Edet and Dr. Egbe Etowa. Dr. Ruby Edet is the Vice President of Canadians of African Descent Health Organization, CADHO, and she is currently the Anti-Racism and Anti-Oppression and Systems Change Manager at the Somerset West Community Health Centre in Ottawa. She is a co-chair with Ottawa's Black Mental Health Coalition, a co-chair for data governance for the National Expert Working Group with PHAC, and sits on the Anti-Racism Board for the City of Ottawa. She holds a bachelor's degree in medicine and surgery from the University of Jos in Nigeria. She also possesses numerous certifications from the University of Washington, including epidemiology, conducting research, project management in global health, and leadership and management in health, among others. With over 10 years of experience working with key stakeholders across the international public health landscape, as well as significant experience working with marginalized communities in Ottawa, she's passionate about improving health and well-being and ensuring the best healthcare access for marginalized communities possible, including for the African, Caribbean, and Black ACB communities in Ottawa. Dr. Etowa is a postdoctoral research fellow at the Ryerson University in Toronto and affiliated scientist with the Ontario HIV Treatment Network. He's a former executive director of CADHO and currently volunteers to serve in the organization. He was a research associate at the Department of Sociology at the University of Windsor in Ontario, and he's a co-investigator on 5 different research projects, including a community-based project to optimize COVID-19 vaccine uptake in Ottawa and Windsor, Canada. Egbe has held 2 consecutive tri-agency postdoctoral fellowships. He's a multi-site We Speak program and multinational CRAFE project research programs held at the University of Windsor and the University of Ottawa, respectively. Based on Egbe's interest in the social determinants of health, he has published articles on the psychosocial experiences of Black mothers living with HIV, influence on policies and cultural factors on infant feeding choices among Black mothers, HIV vulnerabilities and resilience, building among heterosexual Black men, and others. Dr. Etowa is proficient in quantitative approach to research, including data management and analysis, literature reviews, and manuscripts writing, to name a few. He's earned a distinction at the oral defense of his thesis as well upon his return to the University of Nigeria. Thank you for joining today, Drs. Edet and Etowa. Today's session is being recorded and will be uploaded to our N4 platform. We will share this with you as soon as it becomes available. Should there be any technical issues during this webinar, we will inform you with details for an alternate makeup session. And before we begin today's event, I would like to take a moment to introduce you to our platform features to help enhance your participation experience. Throughout today's session, we invite you to write your questions in the Q&A window. We know that sometimes many of you might have the same question or be interested in a particular response. Today, you have the option of upvoting a question. Please upvote questions you are interested in hearing the answer to, and we'll prioritize which questions we pose to the speaker first. As well, today's presentation will include conversations in French and English, and as such, we have live interpreters, Mireille and Séverine, available from Voice, our interpretation services. Thank you so much. Along the bottom of your window, there's an interpretation option. Please select that and check the appropriate language option to listen to the panel discussion or the webinar in either English or French. Our speakers today have no conflicts of interest to declare. So with that said, let's jump right into today's webinar. I'll pass it over to Dr. Edet. And please feel free to turn on your cameras and microphones, Dr. Edet and Etowa.
Thank you so much, Andrew. Dr. Etowa will begin this presentation and then I will join right in.
Thank you. So, yeah, we are talking about the Canadians of African descent, health organizations, strategic role in immigrant integration in Canada. We'll start by looking at some of our critical focus areas. One of them include to advance knowledge in healthcare. CADHO builds capacity for health and well-being in the ACB communities and healthcare and those of healthcare professionals that interface with the ACB communities. We also advocate for evidence-informed health practice and policies. Moving to the next slide, we recognize and value the shared understanding and diversity that exists within and among ACB communities in Canada. So we adopt the intersectionality lens in our in navigating the diversities within the healthcare system and also in addressing the factors that influences ACB health. We authentically engage ACB community with respect, dedication, and keen interest. We foster a culture of accountability and accept responsibility for our action. We think globally while acting locally. Moving to the next slide. CADHO builds capacity of community members and provides and service providers to address healthcare needs of ACB communities through various educational activities. We develop knowledge mobilization tools to inform and spur social action and change for health and well-being of ACB communities and beyond. We also strengthen strategic partnership with ACB communities and other stakeholders, including service providers, decision makers, working with and within our communities. We create mechanisms for dialogue and meaningful interdisciplinary and intersectoral engagement at multiple levels and at individual, community, institutional, and systemic levels. CADHO stands to be the change agent to foster excellence, innovation, and respectful community-driven health initiative with and for ACB communities that address their needs. CADHO mobilizes community members and decision makers to influence health practices, policy interventions, programming, and culturally responsive services for the ACB communities. So moving to the next slide, we talk about how CADHO addresses some of its objectives in ways that enables new immigrants integration. So we'll look at this critically. Let's look at objective 1, which is to build capacity of community members and service providers to address health needs of ACB communities through educational activities. So how does CADHO ensure this? As we can see, CADHO received a TD competitive grant on on strengthening evidence-based critical health and racial literacy to enhance ACB community health. So through this grant, CADHO has implemented a monthly webinar series since 2021, and we've been translating knowledge that will inform health transformation and critical racial literacy among the ACB community. CADHO also has been collaborating with Co-Create Lab at the University of Ottawa to strengthen health providers' capacity to address the health needs of the ACB community during the COVID-19 pandemic. Some of the projects implemented include the CAP projects. We are now implementing the phase 2 of that project. The next slide. So how is CADHO addressing objective 2, which is to develop knowledge mobilization tools to inform and spur social action and change for the health and well-being of the ACB community. CADHO has done this through community collaboration and research partnership, and has developed several KT products, some of which include the CADHO website, which is designed as a platform for knowledge mobilization to communicate results of research funding in ways that can be easily applied by ACB community and health providers. The website itself serves as an avenue for other KTE products, including video documentaries of some of our projects like the CREATE project. It also hosts illustrative manual, fact sheets, policy briefs, which describes sociocultural perspectives of infant feeding practices and psychosocial and some of the psychosocial factors that influences infant feeding practices. So CADHO also the website also holds the AC study community report, which is several other studies report, which informs the community of findings and some of the key knowledge that can be applied in health transformation. And it also holds some of our conference publications, as you can see listed there. Thank you. I pass on to Dr. Ruby to continue with the presentation.
Thank you so much, Dr. Egbe. So I'm going to be speaking about how CADHO is addressing the third objective. And the third objective is to strengthen strategic partners and partnerships within the ACB communities and other stakeholders, including service providers and decision makers within our communities. So as you can see listed here, we have some of our strategic partners. We have academic partners, not-for-profit, and government agencies that we collaborate with to bring knowledge and mobilization to the communities, as well as to work on ACB-focused programs and strategies. So our academic partners, just as Dr. Egbe had listed in the previous slides, we work with the Co-Create Lab, the Faculty of Health Sciences in the University of Ottawa. We also work with the Interdisciplinary Center for Black Health Studies, the Faculty of Social Sciences in the University of Ottawa, on critical racial and critical racial literature, and trying to build capacity of ACB community members to also support these. Since our inception in February 2020, CADHO has built strategic partnerships across various sectors, and all this is in the bid to foster its goals and objectives. We also work with not-for-profits. For example, we're part of the Ottawa Black Mental Health Coalition, and we sit at the OLIP table, the Ottawa Local Immigration Partnership table. We work closely with the African Caribbean Council of HIV/AIDS in Ontario. We also work very closely with PHAG on the National Expert Working Group, where we do the APC study. We work with the Kidney Foundation, and other government agencies. So Ottawa Public Health AIDS Committee of Ottawa and Somerset West Community Center, to list but a few. So objective 4, CADHO is addressing this, and objective 4 is to create mechanisms for dialogue and meaningful interdisciplinary and intersectoral engagement at multiple levels, individual, community, institutional, and systemic levels. And we do this through strategic partnerships with other Black leaders in Capital Region. It is advocated for several changes with positive impact on ACB health. So we're going to talk, key among them was that CADHO was a partner in the advocacy activities that led to March 2nd in 2020 being proclaimed the Black Canadians Mental Health Day by the City of Ottawa. We did this with a lot of other partners, including Ottawa Black Mental Health Coalition, Center La Cap, amongst others. CADHO was also a key partner in the advocacy activities, and we advocated for collection of disaggregated race-based data, which led to the positive result. Today, CADHO is a key partner in the Ottawa area and contributes to the National Expert Working Group that engaged the ACB communities in the collection of race-based disaggregated data that addresses the impacts of COVID-19 pandemic on access to healthcare services related to sexually transmitted and bloodborne infections. Currently, CADHO also sits at the Ottawa Local Immigration Partnership Program as the OLIP health sector and has coordinated peaceful mobilization of diverse groups for the June 5th Ottawa Black Lives Matters protest against systemic racism and police brutality. Now, how has CADHO addressed objective 5? So the 5th objective, which is to be a change agent to foster excellence, innovation, and a respectful community-driven health initiatives with and for ACB communities that address their needs. CADHO has pioneered a weekly webinar series in Ottawa on how to address COVID-19 impacts on the ACB community. We started this in 2020, where we were very responsive to the emerging trend regarding COVID-19 myths and vaccine hesitancy. And we had the first series episode, which was the myth busting episode, and continued dialogue and regular dialogues with the ACB community. We have also continued to engage the ACB health professionals to provide factual information on COVID-19 prevention and care methods. CADHO is also collaborating with the co-create team in the University of Ottawa to implement the Project AVA. And Project AVA is optimizing COVID-19 vaccine uptake in the ACB communities. And this started this year and will span until 2023. So it's a 2-year project that CADHO is being a very critical part of. So these projects actually engage ACB newcomers, immigrants, and community as peer equity navigators, creating employment opportunities and educating community members on critical racial and health literacy and how to navigate the Canadian healthcare system with reduced barriers and increased access. So furthermore, the project strategies leverages on ACB healthcare professionals and human resources for health, including our international medical doctors and our international health professionals who have arrived as newcomers and are seeking or are on the path to achieving their licensing, helping them to remain very relevant in the health sector and to be part of something that contributes largely to our communities. So I want to speak on how CADHO is addressing Objective 6. So we are addressing Objective 6, which is to mobilize community members and decision makers to influence health practices, policy interventions, programming, and culturally responsive services for ACB communities. So CADHO is collaborating with the Co-Create Lab, University of Ottawa, Women's Health in Women's Hands, National Expert Working Group, Toronto, and PHAG as the funding agency to implement a national ACB community COVID impact survey. That's the ACB survey. The survey aimed to study the impact of the pandemic on access to sexually transmitted bloodborne infections and harm reduction services in the ACB communities across Canada. So we conduct board members and led the data governance committee and the data analysis, community engagement, and knowledge mobilization work groups of this program. CADHO has also led the submission of a tri-agency grant proposal in collaboration with the Co-Create Lab, the University of Ottawa, Faculty of Health Sciences, Simon Fraser University, British Columbia, the School of Medicine, Dalhousie University, and a host of other collaborators across country targeting improved health and wellness for the ACB communities. So CADHO was able to get key critical stakeholders across country around the table to collaborate on applying for this. So what is CADHO's? And for this application, if we are granted, the program will definitely be strengthening the capacities of ACB serving community organizations for community engaged research, data management, data governance, and knowledge mobilization. So I'm going to move to the next slide. So how do we serve new immigrants? How does CADHO actually serve new immigrants? We align our existing mandates, our core values, and our visions with programs and service deliveries, targeting ACB newcomers, immigrants, with a focus on internationally trained health professionals, supporting transitioning healthcare access and navigation, as well as resource sharing. So we do this through creating critical health literacy for newcomers. So here what we do is newcomers are recruited as participants in our monthly workshops and webinar series. We also build newcomers critical racial literacy to navigate the healthcare system. So newcomers are able to gain knowledge on how to access healthcare services that exist within the system and within the Ottawa region and landscape. We link newcomers to the cascade of care. We provide newcomer information who need healthcare and information to get them through a network of healthcare providers. We also prepare ACB healthcare professionals through capacity building to be engaged in the health workforce. We provide them with volunteer opportunities, temporary, part-time, and full-time employment, which prepares them for public service employers. A few newcomers have moved on from CADHO employment to the University of Ottawa School of Medicine. We also link them to a network of potential employers in the Canadian healthcare system. For example, a number of part-time workers and volunteers of CADHO have been hired through our network in Ottawa Public Health, City of Ottawa, Somerset West Community Health Center, among others. We also support transitioning for immigrants and newcomer international health professionals. CADHO trains its volunteers in managerial research and community services, and has achieved hands-on learning and networking for a lot of newcomers. So they gain supports and hands-on learning and teamwork and team building for the Canadian job market within CADHO. General capacity building in diverse areas other than the healthcare system. We have leveraged our partnerships to support training of newcomers from diverse ethnic groups through referrals and mentorship. Social inclusion. So CADHO provides opportunities for social networking and referrals to social support networks. We foster social gatherings while observing the COVID-19 protocols, of course. Volunteering. Newcomers have also served as CADHO board members and in various capacities in research, administration, community engagement, knowledge mobilization, communications, data management, among others. And we continue to engage with newcomers who are willing to volunteer in this capacity. CADHO has also had several part-time staff working under the partnership of Co-Create Lab, University of Ottawa, and CADHO. So we do also support to newcomers with part-time employment. Full-time employment. So far, CADHO has engaged a newcomer as its full-time staff, and that was something that made us very excited to do. Transitioning to permanent employment in government agencies or academic institutions, transitioning into academic programs. And for example, we've had at least 2 of CADHO volunteers who moved on to postgraduate academic programs with CADHO giving them letters of support. Transitioning from refugee status to permanent residency status. In the wake of the COVID-19 lockdown in 2020, CADHO offered employment to 2 refugee claimants who had both transitioned into permanent residency within the 1 year of service to CADHO and the Co-Create Lab partnership. Food distribution and wraparound services in the times of crisis have been offered to new settlers. And through the partnerships with the Ottawa Black Mental Health Coalition, CADHO has implemented 3 phases of food relief and distribution during the COVID-19 pandemic. Again, we leverage on our partnerships with potential employers to promote uptake of newcomers, transition to permanent employment in government agencies or academic institutions, and supporting career growth, transitioning to academic programs as well. At least 2 of CADHO volunteers have moved on to postgraduate academic programs, with CADHO issuing them letters of support for this. Transitioning from refugee status to permanent residency, which has happened in the wake of the COVID-19 lockdowns in 2020. So what next? What can we all do to support CADHO? So we want to employ you all as individuals, as community leaders, and as organizations, service providers, agencies, and policymakers to promote the work that we are doing in our various capacities. We employ you to also like our posts on social media, to join us as volunteers, and to fund our activities, promote our events on your various platforms. So with that, I think this presentation has come to a close, and I want to thank you, and we're happy to respond to any questions that you have for us at this time.
Thank you, Ruby. Thank you, Egbe. Those were an excellent overview of the organization and the work that you're doing, and many other elements of CADHO. And it's a very new organization, just like N4, and it's grown rapidly by the sounds of it. So with that, if you're able to stop sharing your screen for a second, and then we can have the quick Q&A. For those in the audience, if you have any questions, please feel free to add them to the Q&A box. I have written down actually a couple interesting ones as well. So one that I had was just related to data governance. From the work that you're doing, where do you see further data governance is needed to help with the work that you're doing, looking at race-based data collection and such?
Excellent. I could let Dr. Egbe go first, and then I would contribute to that, if that's okay by you.
Okay. Yeah, based on studies that we've been doing, we find that race-based data is a very key element in policy making in terms of addressing inequality or disproportionality in access to healthcare. Data can either inform improvement or aggravate inequality. Therefore, having this data governance will enable us to be able to manage data in a way that it does not increase the challenges of inequality in access to healthcare and health transformation. The data will tell us the areas where that needs to be addressed that impact some communities adversely, both the ACB community and other communities. That's why it is a very important element that needs to be looked into. So,
Thank you. And I'm just going to contribute to that. So when we're talking about data governance, we're talking about current tides, which is also data-driven decision making. And just like Dr. Egbe said, to be able to inform decisions that are going to impact the lives of our communities, we have to have data, and we have to have control of this data to be able to look at the data critically and see who's falling through the cracks and where the gaps are, to be able to evaluate the data very critically and know exactly what's going on, not necessarily handling the cleaned data, but seeing, the outcome for every individual aspect of that data. So to be able to make proper decisions that will be very equitable and address, all aspects of the ACB communities. So as we know, sometimes data could be overarching and address the majority, but we will still have vulnerabilities within the vulnerabilities and still have inequities and cracks where people fall through and where data falls through. And being cognizant of the fact that the data represents people, data governance is a very key part in helping to monitor that and close those gaps and be able to inform strategies that are more responsive to the vulnerabilities and the marginalized and aspects of the community.
Of course, thank you. So a question from the audience. Is there any contact or collaboration that CADHO has with the Ottawa-based African Caribbean Health Coalition that hosts health seminars for the ACB community?
I'm sorry, could you take that again?
Sure. Is there much collaboration between CADHO and the Ottawa-based African Caribbean Health Coalition that hosts health seminars for the ACB community?
Oh, no, not that I know of. I do know that CADHO is part of the Ottawa Black Mental Health Coalition, which is a coalition that has 20 plus member organizations, and CADHO is one of that, supporting with the research-based community interface kind of work. So no, but I do not know of the Ottawa-based health coalition. And we would be very happy to connect with them as well, to align and collaborate and align our work.
Yeah, that sounds like a good idea. We can touch base offline and discuss that piece further, and we'll connect you. Another question from the audience is, can members of other communities such as Afghans use the services that's offered by CADHO through its newcomer integration program?
Yes, for sure. CADHO has in the past, we do support anybody that reaches out to us. We promote and foster diversity and equity. And we're welcoming anybody who is willing to volunteer their services with CADHO and learn about CADHO and work with CADHO and learn about research and how to foster transitioning. So if you have any interest that aligns with the 6 objectives that we've spoken about, please feel free to reach out to us, and we will definitely be very happy to collaborate with you and work with you and learn alongside with you.
Yeah, thank you. Thank you. And we can definitely touch base as well with Ramzia, who asked that question. One of the other questions that, and audience, feel free to add more additional questions as well. One question that I came up with while you were presenting was, with respect to the impact that COVID-19 has had on ACB communities, are you able to share any sort of high-level findings that you've had thus far? And are there plans to look outside of Ottawa to other communities across Canada as well?
Well, so with respect to the COVID-19, I'm going to start from the second question. If there are plans to look outside the community of Ottawa, as you know, that we sit on the National Expert Working Group, which is a table that allows us to get the best practices and share experiences with other Black communities and other Black focused communities, as well as other institutions from different provinces across Canada. So that's a very huge learning opportunity that CADHO is leveraging on to be able to respond to what we are witnessing and what we are hearing back from the communities here in Ottawa. And one of the key take homes from that particular table is the data-driven decision making, the importance to be able to listen from the community, not just qualitatively and hear back from the community, but quantitatively to be able to put some kind of framework around what we're seeing in the community and use that to influence and contribute to tables where policy making occurs and where we can influence strategies that actually address the inequities and the health disparities that we're seeing in the community. So in response to the COVID, could you take the first part of that question so I could give you, very.
Sure. Are there any findings that you're able to share at this point in time from the research?
Yes. So I wouldn't want to speak too quickly, but then qualitatively, we're hearing back from the communities a lot of, there was a lot of hesitancy with regards to the COVID-19 vaccinations, and that was why CADHO, alongside University of Ottawa, the Co-Create Lab, currently is working on the Project AVA. And Project AVA is the Advancing Vaccine Initiatives for the ACB communities. And we are actually engaging community members to reach out as ambassadors. They're called PENs, that to rewrite our history. Peer equity navigators are, being engaged to reach out to the communities with factual information on, the COVID-19 vaccine as a prevention, the importance and the side effects, just reaching out to the community and responding in a culturally appropriate, language specific, culturally sensitive manner to the questions that are very valid and are being raised within the communities. So we are seeing a lot of questions and we are collaborating to see how to address the needs that are being identified, because these needs are very valid, and the manner in which these needs are responded to is a priority for CADHO to ensure that the community has understandable information that is digestible, so decisions are made based on understandable facts. So we're basically reaching the community where they are at. But I would let Dr. Egbe to contribute to this as well.
Okay, I will say that as she has mentioned, CADHO was one of the member of the National Expert Working Group working on a survey to assess the impact of COVID-19 on access to HIV treatment and STBBI treatment during the COVID pandemic period. But we are handicapped in terms of telling you the results of that study because we are under a very strong ethics we are still in the process of analyzing the data we have collected. And though we have a few findings, but we are not allowed to share it at this time until the funder has approved that we share those information. So be expectant. You will see many of those results presented in conferences, and we will also present them on our platform, the CADHO website, so you can check there as soon as they are ready for public consumption. Thank you.
Oh, thank you. And very much would look forward to any publications that you would like to also share with the N4 members. We would gladly link them within our resource toolkit going forward too with the results, especially how timely this topic is. And again, to the audience, if there are any other questions, please feel free to add. One of the topics that N4 is looking at is related to internationally educated health professionals. With CADHO and linking to potential employers, are there resources also available for internationally educated health professionals, and how to assist those newcomers with achieving proper certification, going through all the appropriate hoops to get to becoming a doctor or becoming a nurse or any other type of health professional that they were before they moved to Canada?
So currently what CADHO does is that we support transitioning. And by transitioning, we mean that we know that it does take a while to get the license in. Sometimes you need to go back to school. Sometimes you need to study and understand the Canadian concept. But what we do with the transitioning is that we support healthcare professionals to transition into research if that is something that they would like to do. We also help them with networking for those who are seeking path to licensing, because we have had successful CADHO members who have been able to get on the path of licensing, get into residency programs, and get into other healthcare specialties and subspecialties. So through like a mentorship, CADHO could hold your hands and walk you and you know, introduce you to a potential mentor within the ACB community that could guide that pathway and what that could look like. And through those interactions, the newcomer's capacity is properly built to understand exactly what the journey could look like and be able to have a source of livelihood, a source of income while going on that journey. So what we encourage is that while you are pursuing your licensing and heading on your way back, you're able to still, as a newcomer, provide for your family if that is something you're looking to do, or discuss around courses that you would want to do if that is what you're trying and something you're looking to do to improve your capacity, or you know, to transition into a better or another aspect of the healthcare system. So we could have those conversations, connect you to a mentor, and we could definitely support that journey as much as possible and point you in the right direction of where the resources are. So support with navigation and point you in the right direction where you could get all your questions answered. So yes.
Thank you. Thank you. And to add to it, one of our questions is coming from an editor of the Black Ottawa Scene, the only Black Voters News magazine in Ottawa, and definitely will connect you with them to potentially look into a monthly feature as well. Thank you, Godwin, for providing that information. We will continue that connection. One of the other ones is with collaborative partners, as you're a fairly new organization, are there plans to expand to organizations across Canada, or are there similar organizations that you're looking to collaborate with going forward as well that are out west or in the Atlantic provinces or even in Quebec and such?
I could start up and then Dr. Egbe would wrap up with this. So CADHO is largely a collaborative organization, and we're really looking to partner with not necessarily to reinvent the wheel, but to partner with any organization that is already doing work that aligns with the work that we are doing. Because as we know, most initiatives are better tackled, and we are definitely stronger when we are, you know, more and more collaborative in our approaches, a collective approach to tackle the disparities that we're seeing in the ACB community. So CADHO is being intentional about partnerships and does intentionally look out to partner with organizations. As you can see, we were able to pull together a large collaborative partnership to apply for the the grant that was mentioned during the presentation. And we were able to get people from across country to come together and sit to at least apply for the grant. And we're fingers crossed that that will come through. But that is just one example of how collaborative Canadians of African Descent Health Organization is, and is looking to continue in in that stead. So we're very open to collaborations and we're very approachable. And we actually welcome organizations with similar interests to have a sit and a talk with us, and let's see how we could align and do work. And Dr. Egbe?
Yeah, and I would say, yes, collaboration is very important, even though we may not spread ourselves to every part of the country. Like the issue of data governance we're talking about in ACB community will not be only in Ottawa. So that is why we had to partner with other universities, as you mentioned in your presentation, Dr. Ruby, like the Simon Fraser University, the Bassey University, other researchers and communities from across Canada, in order for us to be able to discuss collectively to see how we can put together proposal on the issue of data governance in ACB community. So it is a very key aspect. Even though we cannot operate everywhere, we can join hands with people in other places to accomplish certain projects. Thank you.
Oh yeah, thank you. And yes, I was going to touch on the work that you're doing with the universities as well, and from there working towards expanding the organization. Of course, being N4, us being just as new, we very much understand the the amount of effort that is required to kind of expand the organization across Canada with the scope and the practice and such. So kudos to the work and the effort that CADHO is putting in to collaborate with others as well across Canada. So looking at it, I think with the questions that are here. One final question that I think we can touch on if there are no further questions from the audience. What can our audience, both within the health sector and the settlement sector, do to help? You mentioned it briefly in your presentation as well, to help collaborate with CADHO and work to achieve equitable access and care in their health center or within their settlement organization.
They could promote what we're doing, they could support what we're doing, attend our webinars, be more, just promote us, engage with us in our webinars. Let's keep the conversation and the open dialogue going and unearth inequities and address them, talk about them and bring them to light. Because we know that at these conversations and at these dialogues and through a lot of interaction, a lot of inequities are being brought to light. And when we're able to speak about it and we're able to name it, then they become issues that are being cascaded up on the different tables where all partners sit and people begin to address it. So yes, so as a collaborative, and collective, it will be very important if we're able to promote what each organization is doing that aligns with our goals and our mandates, and to be able to increase reach and to be able to, broaden the scope. And like Dr. Egbe said, we might not be present everywhere, but we're willing to have our presence felt and to support in any way that we can, just to be able to move the work forward and to improve health outcomes for the African, Caribbean, and Black communities that are here in Ottawa.
Yeah, a typical example, if I may say, is the AVA project, where we will need the healthcare providers to support us in the training of the PENS, which are people that will go to the community to increase COVID vaccine confidence. And the services of the healthcare providers is very important. Also, the PENS will do their practical at certain point of the training with these healthcare providers. So that's a very key role for them, because they will provide adequate education to these PENS to build their capacity to be able to inform the community of the right information, give them the right information so that they can take the vaccine. Thanks.
Oh, yeah, thank you. And very, very, very good response. We did get one more additional question from our audience as well, from Godwin. And the question relates to with respect to the current crisis in the Ukraine happening, are there any efforts being made with respect to Black medical students that are looking to relocate to Canada from Ukraine? Are there any resources, or is there any are there any tidbits that you can provide with respect to what's happening with respect to Black medical students that are looking to relocate?
So I'm going to say that CADHO is not directly connected to any of the responses, but I do know, we do know that a partner, ACAO, is working tirelessly on that. And if you're able to reach ACAO through the website, you would be able to know what's going on. And I do know that there has been a connection of over 300 Black students to the University of Ottawa. University of Ottawa is taking the lead at this time to supporting that. But that information is going to be best clarified on the CAO website, or if you could get in touch with a CAO. But CADHO is not directly responding to the Black medical students at this time. However, we are available upon their arrival to support with our navigation and with transitioning for the newcomers who are coming and volunteering services. I hope that responds to your question.
Thank you. And definitely, since we'll connect with them as well after the call, we can further provide. You would likely have the sources related to what you just spoke to, and can definitely connect afterwards. And one final question before we wrap up, with regards to CADHO's webinars, is there a subscription list, or is there any way in which individuals can be alerted for any upcoming webinars that you'll be providing?
Yes, so we do have a mailing list, and we're also welcoming people to register on the CADHO website. It's cadho.ca, and you could go to the website and register and be a part of CADHO, and you would definitely be getting our emails and our information to your emails. So we encourage people to register on cadho.ca, and you could also feel free to reach out to me on LinkedIn, and Facebook or Instagram, or even on the streets, the communities, if you see me walking by, or a family with community mindset. So yes, definitely you could reach out, cadho.ca website, and register.
Thank you. Thank you for that.
Go ahead, Dr.
Yeah, you can also share your, if you would like to be added to our WhatsApp group so that you get regular information about what we are doing apart from the website. Yes, you can also share your WhatsApp number with us as you register. That will be, useful. Thank you.
All right, thank you. And before we wrap up, are there any final statements that you would like to provide? This has been a great discussion today, and I definitely want to thank both Dr. Edet and Dr. Etowa for providing info on the work that CADHO is doing. And before I jump into our wrap-up slides, I'll pass it over to Ruby and Egbe for a final statement.
Yeah, so I want to thank you, Andrew, for giving us this opportunity to share some of the work the Canadians of African Descent Health Organization has been doing. And I just want to just before I step out, say that everyone on this call is welcome to share about CADHO and is welcome to join us at CADHO. And we are looking to, engage the community in surveys, and engage them in opportunities, and engage them as volunteers as well. So CADHO is open, and we're welcoming everyone to join us.
Yeah. So thank you, the N4 team. This is a very wonderful opportunity for us to share what we are doing. And I will say to the audience, there is always a way to support, even if you say you are too busy, or at this stage you cannot volunteer. There is still a way to support CADHO to accomplish what we are doing. Collectively, we can achieve the goal. So you can be a part of us. You can share in our interest. Thank you.
Thank you. Thank you, Egbe. Thank you, Ruby. It's been an excellent discussion today, and I very much want to thank you both for providing the insight on your organization. And let me just share my screen so we can provide our final little wrap up. So again, thank you so much, Ruby and Egbe, for taking time to participate in today's discussion. And many thanks to you, the audience, for joining with us and engaging with us today. And you're welcome to join us again for any of our upcoming events as well. And if you missed any part of today's presentation or would like to watch this session again, we will be posting the recording to our N4 platform within the next week or so. We want to continue the dialogue that this webinar started as well. So if there are any additional questions that you may have, they can be asked as well on the post when we make it for the recording on our meeting place as well. And we've invited Ruby, Egbe, as well as Dr. Benini Cahoon, who was unable to make it today, to respond to your questions there as well. And we've curated several resources related to today's webinar topic from CADHO, as well as a variety from our partners as well. You can find these in our resource toolkit, and we will link them when we share the recording as well. So if you haven't yet, please sign up to newcomernavigation.ca for all our resources and all our learning opportunities. Along with that, Colleen has posted within our chat as well a invite to complete a brief survey related to our webinar to share your feedback. These surveys help us continuously improve and seek out new webinar content and opportunities that are responsive to topics that you are interested in. We kindly ask that you follow that link and please complete that brief survey. As well, please check out our new mobile app that's available for app and Android devices. It is available through the QR code that is there, as well as newcomernavigation.ca/iOS, as well as /Android, or they can be found as the N4 mobile app, Newcomer Navigation on the app stores as well. Thank you again for joining us, everybody. And we hope that you can join us again for any future N4 event as well. Stay safe, stay well, and have a good day. Take care.